Now more than ever, innovative technologies are fueling change and sparking new ways of thinking. Collaboration between corporations and startups is key to staying at the forefront of these trends. However, finding the right startups can be expensive, time-consuming, and ineffective. But Plug and Play is here to help. As a corporate partner, you will gain access to a whole ecosystem of innovation. Discover startups that meet your tech interests. Stay updated on the latest trends and network with industry peers. We will help you during every stage of your innovation journey, no matter where you are and where you want to go. Get in touch today.
All right, we're ready to go. Thank you everyone for coming tonight. This is so fantastic. It's been a long time coming, and this is a super exciting night for so many of us in the room. My name is Jennifer Thomas. I am Managing Director of Plug and Play Health. And before we start tonight, I just want to do some name shout out. There have been so many fantastic people from Hartford who have been working on this expo with us. Dr. Barry Stein, Michelle Cote, Claire Cryer, Joe Catrino, Sonia Cardenas, Beth Chatty, Rocco Orlando, and Danya Field. They were just indispensable in helping us get this done, so just a quick shout out to them. Yes, let's give them a round of applause. All right, I love it. Woo! They've been fantastic. You guys are lucky. You have a great team here. But I also want to say that this was such a fantastic example of collaboration among hospital, state, city, regional, university, business development. So many team players came together in Hartford. We really admire, we at Plug and Play, we so admire this collective vision, especially around health equity. It's super challenging, and everyone talks about it, but it's so challenging to solve, and the fact that Hartford HealthCare and Launc and others chose health equity just shows the determination to really advance care. So impressive. So as you engage tonight with the speakers and the startups, what we ask is that you keep in mind that how together this community is knit, and the leadership that's so committed to improving access to care right here in Hartford. So once again, Plug and Play is super honored to be here. What I'm going to do is just quickly go over the agenda, and then we'll move right on. So I'm just going to give a Plug and Play overview for those of you who aren't familiar with Plug and Play, just to give you a little bit of context. Then Michelle Cote is going to be up giving some remarks about Launc. Then we have Mayor, we're going to switch it up a little bit, we think, because the mayor's not quite ready yet. We're going to have Jeff Flaks, who's President and CEO of Hartford HealthCare. Then the mayor's going to say a few words. Then we have the startup presentations, and this is the 5 startups who have been through the Health Equity Accelerator. And then Joe Catrino, he's Executive Director of Career Life and Design at Trinity College. Barry Stein, of course, who has been completely instrumental in making this whole thing happen. And then we'll have a networking happy hour. So I'm sorry I had to shut off the bar and move you all in, but you'll get back there. And Michelle has told me that the food is going to be absolutely dynamite. So, all right, so let's get going. So just for those of you who are not familiar with us, Plug and Play is headquartered in Silicon Valley. And what we do across the country and across the globe is to connect the world's best startups with our corporate partners, providers, pharma, industry and healthcare, but we have 500 worldwide, with this innovation so that they can bring innovation and technology to market faster. That is typically the goal. And the way we do this is through a platform. We call it an innovation platform. We've started off life kind of as a venture investor, so we've been investing for about 20 years. We're a seed to Series A early stage investor. We do about 200 investments per year, so we're very active. Average check size is 100,000. Some of the startups in the room tonight are our portfolio startups, but not all the startups we work with are. We work with many, many startups, about 47,000 at this point in total. But we've been investing for 20 years, but what we realize is that startups need so much more than just investment. They need to meet their corporate customers. So around 2012 is when we started to connect startups with corporations, and we help them with their innovation, on their innovation journey, really doing that connection, really helping them scout and discover and test drive startups and new technologies so that they can bring it to market faster. And we do this for 500 corporations around the globe. And then, of course, why we're here tonight, we accelerate startups as well. And this is a perfect example of a startup accelerator that we run. We have 60 startup accelerators in 40 countries and in every major industry that you can think of. So we're quite busy. We so enjoy this work, and we're super honored to be doing this here in Hartford today. Just plug and play at a glance. We have about 535 corporations that we work with around the globe. We're up to 643 employees at this point. And as an investor, we have 1,600 in the portfolio with 32 unicorns. So we've been very successful. Started off investing in PayPal and Dropbox. And now we have 3 health unicorns as well, 130 health investments in total. So, and about $9 billion has been raised by these startups in venture over the life of our investing. So this is a really important slide to us. As you can see, we're talking about health tonight, but as our venture associates and analysts do the sourcing to find these startups and do that matchmaking and connecting, they can look across such a broad range of industry. So we even have examples where you're looking for a solution in health and you might find it in autonomous vehicles because they're sort of keeping track of vitals. So we're really looking across a very broad range of solutions. And then here we are globally. You can see kind of where we are. We'd love to do this again in Hartford and really put Hartford on the map and set down some people here as well. In health, we are in Silicon Valley, in Cleveland, Munich, Kyoto, Abu Dhabi, and Singapore. So we have about 7 locations across the globe where we focus exclusively in health. And this just gives you a little bit of an idea of our partners that we work with. We work with 40 in health in total, among them Hartford HealthCare, University Hospital, Pfizer, Lilly, Regeneron, Bayer. And then actually the biggest growing category, believe it or not, is CPGs and industry. So P&G Ventures and Elevance Health, Anthem, just recently signed with us as well. And there you are, Launc over there in the industry too, and government. So it's really been fantastic work here. If you want to know what drives us and what we consider success, really we're looking for our portfolio startups to get to the next level, to find those customers. We love making introductions to both venture and to corporations and providers. 2 examples. Auken, they use sort of biometrics to create more precision treatment in oncology. And Visby, they have a handheld PCR test that can test infectious disease on the spot for sexual health and also for COVID. So we're really proud of those 2 startups. And then partnerships are fantastic for us. We make an introduction, such as how we did with Pfizer and Sidekick, working on a digital therapeutic there in rheumatoid arthritis and ulcerative colitis. And then Roche is working with baby scripts to try to eliminate preeclampsia. And University Hospitals is working with Exploro in order to really help children understand their health journey when they become acutely ill. So that's plug and play for you in an overview. We have an amazing team here tonight as well. So a couple of us will be on stage, Nathan Stunheimer, Peter Toe, and with that, I am going to introduce Michelle. So you're over there, Michelle. Michelle will be our first speaker. She is the director of Launc, and for the past 5 years, she has led the development of relationships with key community stakeholders that help make Hartford a visible and vibrant hub of entrepreneurship and innovation. Working together with anchor institutions and other community partners, Michelle has helped to seed and support several key programs, including Hartford InsurTech Hub, Digital Health CT, and NASA Reimagine. Launc also provides entrepreneurs and partners with connectivity to resources across the Hartford region. At the UConn School of Business, Michelle teaches courses that help students and faculty build critical skills for entrepreneurship and innovation. So, many of you in this room, I'm sure, know Michelle, but I have to tell you what you probably don't know is that she has been so wonderful to work with, and she is a key person in the success of this accelerator. Her attitude is always about what's possible. She's incredibly articulate and passionate and responsive, and she's impeccably organized, which also helped us. And to top it off, she's really super nice. So on behalf of my whole team, Michelle, we're so happy to have worked with you, and thank you so much. We owe you a debt of gratitude. Michelle, Cote.
Wow, Jennifer, I'm humbled. Thank you. Good evening, Hartford. It is so fantastic to be back in person with so many of you celebrating innovation in our city. The focus of tonight's program is very deservedly on 5 incredible companies. It has been a pleasure to get to know them through this program, and I am inspired by the ways that they're using technology to tackle critical health disparities and improve healthcare for all. We need that type of innovation here in Hartford, and I'm looking forward to finding new ways to continue to work through them throughout the rest of the program. However, I also want to emphasize a series of really special partnerships that have helped to make this program possible. Many of us in this room set out 5 years ago to develop a strategy for making Hartford the best place on the East Coast to start or scale a tech business. That level of ambition raised quite a few eyebrows, both here in town and across our community. But as I stand with you here today, I'm proud that we as a community continue to prove that that goal is not only possible, but it's in sight. Hartford has world-class innovation assets, and by working together, we have established networks that help innovators access our expertise, benefit from our resources, and engage with talent needed to help grow their business. By supporting them, we realize the benefits of their life-changing technologies, and we put Hartford on the global innovation map. This program, in particular, showcases both the strength and commitment to innovation that is present here. Despite incredible challenges imposed by COVID, Hartford HealthCare, Trinity College, and Launc, with support from CTNext, dedicated the time and resources necessary to provide 5 companies with a customized experience inside of Plug and Play's Spring Health cohort. We activated mentors from Hartford HealthCare and across our community. We trained and deployed student interns to help them overcome the challenges to commercialization. And we re-energized and strengthened our local network of innovators. I want to sincerely thank all of you in this room for helping to make this community possible, and I invite you to continue to work together with us to make Hartford a globally recognized leader in innovation. And with that, I have the privilege of introducing one of our most sort of passionate partners in this journey over the last 5 years. Mayor Bronin has seen the opportunity that we have here in the city since go and has worked tirelessly alongside us to help make this happen. So Mayor, thank you so much for being here. The floor is yours.
Thank you so much, Michelle, and thank you to the entire Launc team, and good evening, everybody. It is great to see everybody here in this beautiful and historic building in downtown Hartford. Michelle talked about our joint goal to make this city the easiest and best place to start or scale a business on the East Coast. And I think tonight is a pretty powerful demonstration of why that is a serious, realistic objective. When you've got one of the largest, most innovative healthcare systems and hospital systems in the region and in the country, in Hartford HealthCare, with their CEO, Jeff Flaks, here tonight, when you've got a world-class educational institution like Trinity, when you've got both state and local working together with City, Launc, and CTNext working at every level in partnership. And then when you've got a national or global leader in accelerating innovation like Plug and Play, that is an incredibly powerful combination. And what makes it even more powerful is that in a city like Hartford, every single one of those partners can reach out to countless other partners at decision-making levels, whether it's CEOs, whether it's leaders in the public sector, whether it is global leaders in that innovation space. Everybody in Hartford is committed to this work. Everybody's invested in this work. And I think that's something that's unique. You're not going to find that in a metro area that's 10 times our size. What you've got here is an incredible concentration of talent, an incredible concentration of higher education institutions, an incredible concentration of research institutions, an incredible concentration of industry leaders who are all committed to making this place a hub for innovation and excellence in this sector, in health in general, also in InsurTech, in advanced manufacturing. And so I'm so thrilled to see this turnout tonight. And also, as Michelle said, so inspired by the companies who've been part of this cohort. You know, our hope is that this is just the first of many cohorts that comes here, that grows, that builds relationships, that sinks roots, and then continues to grow here in Hartford. But it's particularly powerful that this cohort is focused on an issue that is central not just to economic growth, but to community well-being. On health and on health equity. And every single one of these companies is doing something innovative and powerful to expand access to healthcare, effectiveness of healthcare in a way that matters to every community, including a community like Hartford, where there are, in the Hartford region, enormous disparities in healthcare outcomes and healthcare access. So I'm so grateful to every one of the companies that chose to come and be part of this cohort. The invitation that I made at the start of this process stands, which is that our door is always open, my phone is always on, and anything we can do to help you stay and grow in Hartford, we want to do. And then my ask to everybody here is to help spread the word. To anybody and everybody you know that this is a community that is unique and rare in its collaboration, in bringing public and private sector together, all of the partners that need to be part of building a healthy innovation system, ecosystem working hand in hand. So again, to Hartford HealthCare, to Trinity, to Launc, to CTNext, and of course to Plug and Play, which we're so thrilled to have here in Hartford for the first time as part of this effort. Thank you for everything you've done, and I can't wait to see what comes next. God bless and go Hartford.
Fantastic words. I second those. Thank you so much, Mayor. It was an honor to have you here tonight. So our next guest is Jeff Flaks. He is one of healthcare's most progressive leaders, as many of you already know in this community, transforming care delivery over the course of nearly 3 decades. As president and CEO of Hartford HealthCare, he leads this $5 billion enterprise, caring for more than 1.7 million patients and customers. Hartford HealthCare's network is an integrated system across more than 400 locations, unified by its innovative access center and singular electronic health records and imaging systems. And Jeff just told me that there's a brand new office going up just around the corner, so maybe that's 401. But I heard it's going to be fabulous, and I can't wait to come back and take a tour. Jeff is a bold and visionary leader, as you all know. He championed the Institute model at Hartford HealthCare, which offers the highest standards of integrated care across 6 clinical areas. For example, through this model, Hartford HealthCare's Cancer Institute became the charter member of the Memorial Sloan Kettering's Cancer Alliance, extending access to world-renowned cancer research in Connecticut, which is absolutely amazing. Mr. Flaks began his tenure at Hartford HealthCare in 2004 and has served in a variety of executive and operational roles prior to his current position. He is a proud Connecticut native who is passionate about the culture of the organization, and he believes business leaders must be led by example and has made a commitment to creating an organization that values its colleagues and celebrates diversity and inclusion, and was honored by the National Association of Hispanic Healthcare Executives for his leadership. So he serves on various councils and boards. Among his numerous governance appointments, he is director of the Connecticut Science Center, Connecticut Public Broadcasting. He's a director, excuse me, appointed to the American Hospital Association's Health Systems Council. He provides leadership and advocacy on public policy, both nationally and regionally, and he serves as co-chair of Connecticut's governor's COVID-19 Health Systems Response Team. That is only half of his bio. The other half you have to go read online. But the most important part is that, as you know, Dr. Barry Stein cannot be here tonight, but when I was asking Barry about you, Jeff, what Barry said was Jeff has always had a vision for health equity and is an ardent supporter of this work. So please give it up for Jeff Flaks.
Thank you so much. Good evening. It is so wonderful to be here and to be present together, to be in Hartford, and to see so many energetic, like-minded people who want to see progress and are looking to do great things together. You know, as the mayor spoke earlier, we made a commitment to move about 750 of our colleagues in Hartford HealthCare into the city in this moment at 100 and Pearl Street. And in many ways, we did that because of our absolute belief in the capital city. And we want to infuse more energy, more people to support what we're really doing here tonight, which is trying to recruit new energy, new opportunity for everyone within our city and within our state. You know, I want to begin by just thanking CT Innovations, CTNext, Launc, Trinity College, all of the HHC colleagues, and Plug and Play. This is an example of how collaboration works in action. And it's these organizations coming together with a broad vision and a real sense of purpose to create a better community, to bring world-class healthcare to our region, and to create economic value for everyone, as many people as we can. In establishing this healthcare accelerator, we're focusing on 5 companies tonight who are focused on health equity. And these startups, these are disruptors, right? These are people who are asking, why not? How we can do things differently. And this is critical because companies like this and entrepreneurs and pioneers will be the engine to help us transform healthcare and solve the complex problems that we have today within healthcare. I truly believe as we're going to see these 5 companies and we're going to see these emerging leaders, these are the people who can change the world. These are the people who have extraordinary aspirations. And it really begins with our ecosystem and what makes this region so special. And it's because the mayor described it. This is a community where people come together, where people support one another, where people have a sense of personal connection, discretionary commitment to this community. And this is also a community that has an enormous collaborative spirit. So those special ingredients are what's going to make Connecticut different and what makes us the type of state, this city, the type of city that can spawn great innovation, that can bring people together who are going to change the world. So I'm so encouraged about these new solutions. When I think about this region, there are just 2 proof points in particular, and we experienced them in Hartford HealthCare just in the last few months. I'm so excited that One Medical and Amazon Health picked Hartford HealthCare to be their partner, to be their first statewide partner, to build their new model of care, their subscription-based medicine service in Connecticut. So Amazon and One Medical could have picked anyone in the country. They could have gone to any community. Why did they pick this community? And they picked this community, again, because of this culture, because of this sense of commitment to one another, because of our capacity to execute on our vision, and because of the collaborative nature of public and private organizations coming together and supporting one another. Secondly, Optum and United Healthcare is building their first statewide risk-bearing entity here in Connecticut. We're getting phone calls from people all over the country wanting to learn more about what Optum and United Healthcare is building as their first joint venture with a provider-based organization with Hartford HealthCare. So together we're building this new model of care, risk-based entity, where our health system with Optum will go fully at risk. So we're going to drive care to be more affordable, more accessible together. Why did Optum pick us? Why aren't they doing it in Boston? Why aren't they doing it in Dallas? Why aren't they doing it in the West Coast? Because Connecticut offered them such a unique opportunity to work in such a coordinated fashion. That's what makes this region so special. And that's why we are really the ideal state and region in terms of our size, our scale, the talent that exists within our region to bring people together to do great things. And we have limited bureaucracy, and we have people who are problem solvers when it exists. Now, in healthcare today, look, we have significant challenges. But at the same time, I'd ask you to think about it from this perspective. Healthcare has never been, it's never been better than it is today. This is the best healthcare we've ever delivered in our history. And as we go into the future, this is the worst it's ever going to be. And the reason I say it's both the best it's ever been and the worst it's ever going to be is because the rapidity of change, the amount of innovation, the amount of new ideas, the new solutions that are coming forward, the new technologies that are being leveraged are allowing us to have a level of change and an improved cycle of change better than ever before. So when we think about healthcare today, we have to appreciate the fact that healthcare is not nearly as accessible as it needs to be. Healthcare is not nearly as affordable as it needs to be, right? We have to bend that cost curve. Healthcare still, from an excellence perspective, is too inconsistent, right? Quality is too inconsistent. Safety, we need to improve safety in all of our services. And in particular, the fifth area of focus, right, equity. Healthcare, if we've learned one thing during COVID, that healthcare and the work that we need to do around health equity is absolutely essential. I've said throughout this crisis, throughout COVID, thousands of times, is that in all aspects of our life during COVID, we want and must and yearn to go back to normal. But in healthcare, we cannot allow ourselves to go back to normal. Back to normal wasn't nearly good enough. We have to be better than normal. And when we think about being better than normal, it begins with health equity. The fact that what we learned about people within our communities, particularly people within our inner cities, within our rural communities, right, our peers within our cities, we saw that somebody's zip code should not determine their health status, right? It's completely unacceptable. The fact that where we are in Fairfield County, if somebody's born in Bridgeport or they're born a mile over in Fairfield, that they can have a 21-year life expectancy difference, that's completely unacceptable in this country. It's completely unacceptable within our communities. We must do something to affect this. It can't be somebody's zip code that determines your health. It should be your genetic code, right? We have so much work to do around health equity. So we have a mandate to change. We must solve these problems, and we cannot solve these problems with yesterday's solutions. We have to challenge ourselves to think and act differently. We have to take more risk. We have to be more bold, and we have to be more courageous as leaders. Now, this is within our DNA. It's absolutely within our DNA. I love the fact that MIT and the dean of the analytics program, Dr. Demetrios Bertsimas, comes to Hartford all the time. We've worked for 6 years together. But I love the fact for the most recent company he launched a new startup company with Hartford HealthCare called H2O. He didn't do it in Cambridge, where MIT is located. He did it in Hartford. And when you ask him why Hartford, he says because he's never worked with an environment that's more supportive of startup development and innovation. And MIT comes up 84 to do their work in Connecticut. When I talk about the relationship we have, the very special relationship with the Israeli Economic Authority, when Israel came to the United States and they said, we need to find specific geographic locations to domicile the innovative companies that are emerging out of Israel, where they have a market of about 8 million people that come to the United States with 350 million people. And they looked to pick 4 organizations initially that they would sign memorandums of understanding with. They picked Hartford HealthCare. They picked Connecticut. Why Connecticut? They could have gone to New York. They could have gone to Boston on either side of us. They picked Connecticut because they recognized that this is a unique community, a unique geography, and a culture within this community that supports development, that will do everything possible, as the mayor was describing today, to knock down barriers and create opportunities for all. You know, when I think about innovation, first and foremost, we're trying to build world-class healthcare. Our communities deserve it. And at the same time, we want to create jobs, we want to create economic sustainability for our communities, and we want to create opportunity for all. And as we bring more startup companies here, as we create more innovative approaches to solving historic and complex problems, everyone will benefit, and I'm certain about it. Our region is truly perfect as an incubator. So as I thought about coming here tonight and making remarks, I thought about a person. I said, how I want to inspire, or I want to create more. And I said, who can we think about who really tells the story? And I just spoke about MIT and Optum and Amazon and all these unique things that are happening now. But I went back to 2004. And when I first joined Hartford HealthCare, a gentleman by the name of Eric Rosso was leaving Hartford Hospital at the time. He's a graduate of Trinity College. Eric was a rower at Trinity College. And when he left Trinity, he came and worked about 9 years, rose the ranks, and became the director of biomedical engineering at Hartford Hospital, which is one of the country's leading biomedical engineering divisions in this nation in healthcare. And during Eric's tenure, he had ideas. He saw how things could be done differently and done better. And within Hartford Hospital, he created, over the time of his service, a new technology system to manage hospital transfers and to do bed management. And in those days, it was done manually. Nurse coordinators would walk around with envelopes, and they'd write on the back of the envelope. And we had tremendous barriers to care, tremendous issues around quality and safety and safe transfer. And Eric said, there's a better way to do this. And he created something that really began to work and make a difference in Hartford. And Eric approached the Hartford Hospital leadership at the time, and he said, I'd like your support. I think what we've created here is special. I think it's different. And I think it has application that can go around the world. And this happened over in the Healing Triangle on Seymour Street. The hospital wrote a check for $500,000 at the time in 2004 to help give him an investment as a loan, to help start that company, to create something special. Between 2004 and then around 2000, I think somewhere between 9 and 10, Eric sold the company to Eclipsis, which then became the central kind of bed management system of Allscripts, for $38 million in 2008 when he sold the company. And he created jobs and he created opportunity, and people came from all over the world to Hartford Hospital to see that system work. And today it pays dividends around the world, around safety, around quality, around care coordination. But Eric then, this is a serial entrepreneur, he saw there was bigger and more opportunity, and he launched a second company called Diameter Health. And over the last decade, Diameter Health went within clinical informatics and looked to use and harness data to drive better clinical decision-making, where there's massive opportunity. And just in this last year, Eric sold his second company, Diameter Health, to Availity. And Availity is the largest health data company in the country. And when I think about inspiration, we're going to look at 5 people today. These 5 people all have the potential to be the next Eric Rosso and beyond. But Eric's made a difference in terms of what Diameter Health has done, what Premise did. He changed healthcare all over the world. I mean, these systems are well outside the United States. And Eric, I saw him here. If he could raise his hand, I'd just like to recognize you for what you've done for Hartford. All right, we talk about what can be done. Eric did it, and he still is a great friend of Hartford HealthCare, an advisor to us, and he's not done yet. He's got more and bigger ideas, but he did it here in Connecticut. He built these companies here, and he took them globally. It can be done here, and it has been done here. So as we think tonight about what we're going to learn more about, I'd ask you to think about where healthcare is going. Healthcare is going to the home. We're going to have hospital beds in the home. We're going to have physicians making house calls like the old days. People are going to be wearing home monitoring devices. We're changing healthcare, right? Apps are going to be giving us real-time information. We're going to be doing interventions and medication compliance, all remotely, all through the home, all through technology. We're going to see demand matching. Right? You think about what's being done with airlines. When do you see a seat open on an airplane? I come into Hartford at midnight from some unknown place. I'm like, how could there not be a seat open on this plane? Right? They have mastered predictive analytics. We're going to see within healthcare, we have 4,000 physicians within our health system alone. We have to do a tremendously better job of matching people so we can accelerate care and accelerate the right intervention at the right price point, at the right level of access. We're going to see issues around personalized medicine. Right? There is tremendous opportunity to see more medicine be personalized. It will create more safety, more utility, and more efficacy for the people we serve. We're going to see the devices, medical devices that are being created today, and the artificial intelligence that's being used around these medical devices It's like nothing we've ever imagined before. I was so proud right before the pandemic. If you would go down Hudson Street, you'd see on the first floor of the Center for Education, Simulation, and Innovation, the rooms were blacked out for about a year because we had Medtronics, a worldwide company, effectively take over the ground floor and the wet labs of our center so that they could create their spinal robotic technology here in Hartford on the campus of Hartford Hospital. And why do it here? Because we have an extraordinary medical staff, we have unbelievable talent, and we have incredibly committed people to advancement. And that's the culture we've created, and that's why places like Medtronics choose us. So we're going to see 5 disruptors today, great startup companies. I just want to be clear, we pledge our commitment to this work within Hartford HealthCare. We're going to continue to harness our sandbox, our talent, our people, our resources, our broad and diverse patient basis, the diverse services we provide to try to create world-class healthcare, create more economic value, and ultimately to make healthcare more accessible, more affordable, higher levels of excellence, and more equitable. So we're so excited to be here. We love the fact that the entrepreneurs we're seeing today have a social conscience, which is consistent with our values. And I'm just excited to see us back in the room together, all working in the same direction of committed people, well-intentioned people. And again, the 5 partners we're working with, and specifically our relationship with Trinity College, is so historic and so special. This is a wonderful night for all of us, and I thank you for your attention and, most importantly, your commitment. And we're going to help make these companies and many more very successful. Thank you so much.
Wow, that was so incredibly inspiring. It makes me want to move to Hartford. I think you guys have absolutely all the variables you need to be the next great healthcare city if you aren't already. So thank you so much, Jeff, and thank you, Michelle, and thanks to the mayor. It's been so fantastic listening to the community, and now we're going to hear from the startups. And moderating that piece of it is Nathan Sundheimer. He's on our team. He heads corporate partnerships, started off as a program manager, and has been absolutely key in getting this whole expo to happen. So welcome, Nathan.
Cool. So thank you, Jennifer, and hello all. My name is Nathan Sundheimer, and I head U.S. Healthcare Partnerships here at Plug and Play. And I want to say it's so good to see so many familiar and new faces here today. As Jeff, Luke, Michelle, and Jennifer all stated, our ambition with you, everyone here today, the startups, the greater ecosystem, is to work together cohesively and collectively to ameliorate health equity barriers in our community. And so we are so thankful and appreciative to have you all here with us today. But for many, the question is, how did we get here? So we started back in this journey back in March. And we brought a number of startups and presented them to a greater community from Hartford HealthCare and the Hartford ecosystem. And we chose 5 startups that did one of or all of 3 things. 1, they tackled social determinant of health. They improved access to care, and they did something to bridge the digital divide. We then got them to come here in June, where it was an opportunity for the startups to really embed themselves in the community, really get a feel for the community, really get an idea of what it really means to be here in Hartford. And during that day, they had an opportunity to meet and engage with many of you. Ultimately, we come here in September for our expo. And we don't really see this as a graduation per se. It's really more of a launch pad for greater engagement and integration to drive tangible, impactful results with the Hartford community and beyond. So over the last couple months, these startups, ever since from March to September, they've been engaging with mentors, workshops, webinars, networking sessions, taking advantage of every single opportunity that they can to really be impactful and be as involved with this community as possible, but always there's room for more. So we really look forward to further engaging these startups even beyond today. But today, each startup has prepared a presentation for you. We will not be having Q&A, but we strongly suggest that you keep a few questions in mind when you have the chance to meet them during the networking hour at the end of this event today. So first, I would like to bring on Viora Health. So Viora Health is a Philadelphia-based company that uses technology to improve patient access and care and experiences for programs that reduce disease progression to improve outcomes and reduce episodic costs. So I'd like to bring CEO Deb Dutta to the stage. Thank you.
Hello, everyone. My name is Deb Dutta, and I'm the founder and CEO of Viora Health. I'm also a two-time entrepreneur and a curious learner, lifelong learner. Thank you so much to Plug and Play, Hartford HealthCare, and Launc for providing me this platform and opportunity to share our story with you today. Let's start with the story of Sheila. She's one of our participants in our program. She has prediabetes, hypertension, she's socially isolated and faces low health literacy and lives in a food desert. Now, when Sheila shows up at her healthcare provider, she's provided a treatment plan and sent home. But she doesn't necessarily have the tools or the know-how to follow through. And so in a matter of a few months, she ends up in the ER, resulting in poor patient experience, poor outcomes, and high costs. The truth is, 70% of people, just like Sheila, drop off evidence-based treatment protocols. And on the flip side, 80% of healthcare outcomes are in fact driven by social needs and lifestyle barriers. And this is resulting in billions of dollars in episodic costs, ER visits, absenteeism, and missed doctor's orders. The reason is that current solutions don't really acknowledge health literacy gaps. They're typically a Band-Aid fix, and they don't offer culturally competent support. And on the other hand, health systems are facing an unprecedented gap in staffing shortages, visibility outside the office to their patients, and they're also burdened with tracking social determinants of health data. Introducing Viora Health. Viora's program engages rising risk populations that face high social needs and are also high costs, who are struggling to meet their healthcare goals at home. We've built technology that wraps around and enhances existing healthcare workflows to engage this rising risk population at home. Patients are referred to our app, and we do an assessment and then use algorithms to triage people, identify social needs, and create a personalized program to mitigate those needs. Automated touchpoints engage participants every week, and patients are further supported by a Viora case facilitator, as well as through peer group interaction. And finally, we report performance on social determinants of health, as well as patient-reported outcomes over time to close the loop. And we have the outcomes to show for it. While 70% of minorities dropped off evidence-based diabetes prevention and diabetes programs, our retention rate was 80%, or 2 to 3 times improvement over a one-year period. And we've this resulted successfully in reducing weight, A1C, and closed gaps in health literacy, social isolation, and food insecurity. We've submitted this 1 year worth of data to the CDC to get a stamp of approval, which now provides us access to a billing code of about $700 per patient. And our model is fundamentally different from the status quo. While current models like Amada and Livongo, which are disease management solutions, have underserved populations that typically drop off in the first 10 weeks, our solution is specifically designed to engage this population. And unlike competitors, our front end is simple, while our back end of the software is sophisticated. And we further improve adoption by using text messages from the point of view of participants, as well as content delivery that's at a 4th grade reading level. For patients, we are offering continuity of support, improved experience and access to care. And for our paying partners, we are enhancing capacity, improving visibility, reducing admin burden, and closing the communication loop to improve quality and reduce costs of care. Our revenue model is business to business, where our paying customers are health systems, employers, and health plans, and our market is large at $18 billion with a growth rate of 26% and resulting in a 3 to 5 times return on investment. We have a clear plan to go to market. We have received funding from eminent names like the National Institutes of Health, particularly focused on minority health, American Heart Association, and Johnson & Johnson, to extend our paid proof of concepts. And we've recently received a recurring revenue contract as well as an inbound inquiry from a second partner to help us scale their existing models using our solution. We are well positioned now to leverage these results to gain access to $1.5 million in additional non-dilutive funding, and this further de-risks investments for you. In November, I'm excited to announce that I'll be pitching at the Health Conference in Las Vegas, and past presenters have raised $2 to $4 million by pitching at this event. So we're really looking forward to this. This attracts thousands of top investors and customers in health. This opportunity today is very timely and valuable to both Viora Health and Hartford HealthCare. It will allow Viora to scale our proof of concepts to fundraise and grow. And it will help Hartford HealthCare to gain early access to our technology to test feasibility within their universe. Our objective, ultimately, is a commercial partnership with Hartford HealthCare. Based on our current discovery, which we've had access to in the past few months, to Hartford HealthCare's leadership, we have proposed a phase 1 partnership to the leadership team. And given Rocco and Barry's vision for health equity, my hope is that this accelerator will reduce the time to execution and remove hurdles that typically startups face in commercializing their innovation. Our solution will help Hartford HealthCare not only meet their community health goals, but also improve revenue, quality, and reduce costs of care. Thank you so much for this opportunity, and I look forward to speaking to you at the networking.
Awesome. Thank you so much, Deb, and really appreciate the presentation on Viora Health. Excuse me. So next, we have CareAdvisors. So CareAdvisors is a Chicago-based company that connects patients to the best resources and rapidly enrolls them in benefits that address their social care needs. So today, I'd love to introduce Chris Grace, CEO of CareAdvisors.
Welcome. Thank you, everyone, for coming. I am Christopher Grace, the CEO and founder for CareAdvisors. So a little bit about our company and the work that we do. As a company, we offer a software platform to address the social determinants of health, where we contract with hospitals, health plans, and community-based organizations to help them build a full ecosystem for social care management, including automating government benefits enrollment, building a network of social service provider partners, and setting up an alternative payment model to support long-term sustainability for the program. Now, when we talk to hospitals and health plans throughout the country, they feel like they do a great job in healthcare in the four walls of their institution. But when it comes to expanding out into the community, there's a lot more uncertainty. And the big question that we get is, how do we build a sustainable program for social care management that can service tens of thousands of lives? And how do we have a simple roadmap to bring together data, the power of software, and a sustainable payment model to accomplish that? And that's what CareAdvisors really brings together for our platform. We offer the first complete solution that can bring together data infrastructure, automation to have an efficacious impact on healthcare outcomes and developing a sustainable payment model to support that. That starts with our equity information exchange that brings together really for the first time a longitudinal record of both human services and clinical data so you can see the impact of social service interventions on healthcare outcomes. And then we combine that with our automation platform for complex manual tasks in social care management like enrolling in government benefit programs. We can manage processing enrollment in Medicaid for 2,000 applications in an hour. It would take a community health worker more than 2 years to do that manually. And then we have a significant impact in bringing this together. We have better than a 90% effectiveness rate in resolving social needs in patients on our network. That's 40 times better than just using a standalone online resource referral directory tool. We offer our platform in a shared cost savings model, so providers can finally get paid for the social care management work that they're already doing through attractive care management fees. And then we take a portion of that investment and expand into our social service provider partners so they can make the impossible cases possible in expanding resources for housing and food insecurity in the local community. Now, what I'd like to do is share with you a patient journey so you can really get a sense of the impact of the CareAdvisors platform. So I want to introduce you to Jim Reynolds. So he's an actual aggregation of 3 live patients on the platform that we brought together for illustrative purposes. So he's older adult, dually eligible for Medicare and Medicaid. He suffers from congestive heart failure with comorbidities and hypertension and diabetes. And throughout his journey, we're going to uncover a variety of social needs, including needs for housing, food security, and we'll show how we address those through the CareAdvisors platform. So in the first half of the year, we're going to look at Jim Reynolds' journey without the CareAdvisors platform and what the impact is. And then in the last half of the year, we'll show the implementation of the CareAdvisors platform and show the overall impact. So in the first half of the year, we begin to see emergency department visits for uncontrolled congestive heart failure from Jim Reynolds through emergency departments that are affiliated with his primary care medical home. So right now, his care coordination team suspects that these can potentially be avoidable emergency department visits, but there's some latent needs that they haven't uncovered and how to address those. Additionally, there's, unbeknownst to his primary care medical home, there's additional out-of-network emergency department visits where there's missed opportunities for care coordination. And when we talk about entering into a value-based payment model, we're impacting total cost of care that you're only going to see at year end for that reconciliation, which is another significant problem. So now let's look at what happens with the impact of the CareAdvisors platform. We first start with the equity information exchange and bringing together that clinical and human service data. So now, when those emergency department visits, not only do you just get an ADT, but you get the full clinical record for discharge summary, medication list, imaging, and test results, so you can facilitate informed care coordination for those out-of-network visits, and you're not missing those opportunities. Secondly, we can leverage our automated social needs screening tool where we have data sharing relationships with utility providers, consumer credit records, in addition to social service utilization data from the state and our partners. And we begin to understand that Jim Reynolds is a high risk for housing insecurity because he's more than 90 days past due on his utility bills. So now the community health worker gets an alert, and he can understand that Jim Reynolds is living in the garage of a friend, and that's a huge contributing factor to why he can't manage his medication, and he's cycling in and out of the emergency department. So now that we know the problem, we can begin to address the solution. So that starts with helping Jim Reynolds enroll in a variety of government benefit programs through our web-based, mobile-friendly allied benefit portal. We can also get Jim Reynolds connected to expedited cash assistance for moving from that garage into the community, into stable housing. We can get him connected to a pharmacy assistance program and non-medical administrative transportation to take him to the local CVS that's more than 2 miles from where he lives. And then finally, we can get him connected to a home delivery meal program to address his food security needs. So when he's moving back into the community, he's able to get back to his weekly therapy, as well as his ongoing cardiology visits. And there's a significant cost savings from this impact that we use to leverage and pay for the platform, and also have attractive care management fees for our provider partners. So when we look at just an overall impact of what the company has been able to achieve, I'd like to give you some summary statistics here. We have tripled revenue over the last 12 months to get to a $3.3 million recurring revenue rate. We've raised more than $5 million over the life of the company. We have 14 enterprise customers, and we're live in 5 cities, including Chicago, New York, LA, Detroit, and Cleveland. We'll be expanding to 10 cities in 2023, including Hartford, and we just have launched our largest network to date that includes a $50 million partnership with a variety of payers and some of the largest providers in the country in the Chicagoland area. I'd like to summarize really the impact that the Accelerator program has had in coming to Hartford. And I can't thank enough the Launc program, Hartford HealthCare, UConn Health, and Trinity. You guys have been great in hosting and serving as a Sherpa for us to better understand the local Hartford network. We've identified 2 great commercial opportunities that we're working through, including establishing a social care center here in the Hartford community that will include local hiring and partnerships with providers to address a broad population for social care management. We're also working on an innovation partnership to identify the first model for predictive analytics for early detection of social needs in a pediatric population. So we're excited about both those opportunities next year. So I'd like to conclude with thank you so much for the opportunity for the Accelerator, and I look forward to following up with everyone in the networking. Again, my name is Christopher Grace, the CEO for CareAdvisors. Thank you.
All right. Thank you, Chris, and thank you, CareAdvisors. Up next, we have NourishedRX. And what NourishedRX does is they make high-quality, individualized, nutritious food accessible to the people that need it most. So I'd like to bring Chief Growth Officer Jeff Hancock up to the stage. Jeff, floor is yours.
Good to go. Good evening, and thank you for joining us this evening. First, I'd like to thank Hartford HealthCare, Launch Hartford, Connecticut Innovations, and all the rest of the partners here, Plug and Play, for allowing us to participate in this inaugural healthcare cohort. I'd like to take a moment first to unpack the tagline that we have at NourishedRX. NourishedRX believes at the heart that food is health. How many of us tell our children every single day that you are what you eat? Probably most of us. Food is also care. When a mother has a new baby or if there's a death in the family, food is still the go-to item, component of care and sympathy that we deliver to people that we care about. And food is healthcare. We are proving that every day here at NourishedRX by really diving into the components of bringing food and access to nutrition to the home of our participants. So why is it so hard to be healthy? I think I went too far. Apologize for that. There we go. So why is it so hard to be healthy? The answer is that everyone doesn't have the same access to food and nutrition. That is a key component to health, is that access, and we believe at our foundation that that's the mission that we need to bring, and bring health equity right to the doorstep of people that need it. There are a growing number of companies focused on food as medicine. What makes NourishedRX unique? We are unique because our solution is personalized and individualized to the needs of the participant. We ask about cultural preferences. We ask for meal types that you need, condition-specific food, pave the way for the most productive and effective solution on the market. Our mission is to support vulnerable populations who are dealing with health and food inequity. Finally, the driving goal of NourishedRX is lasting behavior change within the population. This lasting change leads to a more fulfilled and whole life for the participant. But food is just the start. It opens the door into the home and allows us to build relationships with the individual. It's through this relationship where whole person health becomes a reality. Our team communicates with program participants on an ongoing, often weekly basis. Yes, the main reason for these touch points is because we order the food for them on a week-over-week basis, but as our relationship grows, we're able to uncover gaps in care like medication adherence. We see the non-medical needs and hear about the non-medical needs around housing, transportation, childcare. And we try to get those members and those participants really connected with funding sources such as SNAP and WIC that they may be eligible for. And finally, we're delivering actionable insights back to our care management partners who are responsible for the health and well-being of the individuals. To create this personalized food journey, first we need to understand the person, and we do this through a whole person analysis. Our wellness associates connect with the individual to really dive into the needs that that individual has. What is their functional status? How can they store food? How do they prepare food today? What is their sentiment towards food? It's really hard to move somebody that's been eating fast food for 3, 4, 5 days a week to a kale salad. There's a process that has to happen there. The next step is each participant is assigned to one of our registered dietitians, our team of registered dietitians, who utilize a proprietary food and nutrition engine to personalize the food journey for that individual. Do they need to start with prepared meals, or can a meal kit do the job? Or are they far enough along in their own personal food journey that we can just immediately bring in grocery produce and pantry boxes into the home? We want to start the participant with the modality of food that will set them up for success at the very beginning. I'll pause here and I'll look at Michelle because we had this conversation the last time I was in Hartford. Our goal is to bring the local food system to the home. We want to partner with local food providers in and around Hartford as we come into the Hartford area, which I'll be talking about in just a moment. We do have national vendors, but our goal is this local food ecosystem because we know that when the food stops being delivered by whoever's delivering it that's paying for it, whether it's Anthem Blue Cross or Hartford HealthCare, whoever it might be, that behavior change will not stay unless the individual knows where to go get the food. And so that local food ecosystem is extremely important to our model, and it's unique in the industry as we think about food as medicine. And then finally, in an effort to support ongoing lasting dietary change, we provide educational materials. We make available our registered dietitians for consultations throughout the program. We're connecting to any community-based resources. I know Hartford HealthCare has community-based resources in Hartford to be able to go into the home. And finally, again, we're helping that individual find funding that they're eligible for with SNAP and with WIC. And we're going to see if this works, but I have the pleasure of introducing Martha.
That changed me. I started looking forward to every day getting up preparing those meals.
Wow.
And I did not miss, and they know I probably, not one day. I enjoyed the variety, number one, because it made me eat items that I never would think about cooking.
Martha's somewhat of a celebrity. I'm not sure who all got to participate or listen in on the White House Conference on Hunger, Nutrition, and Health yesterday, but if you were looking at that online yesterday, she was one of the featured videos, and our founder and CEO, Lauren Driscoll, was able to go and participate yesterday as well. So if you can look at her later, she's great, much longer video on there, but she's just one of the individuals that we've been able to touch with our comprehensive nutrition program. So as we wrap up, I'd like to share a little bit of detail on a pilot program that we're going to be starting in early 2023 with Hartford HealthCare and Anthem Blue Cross Blue Shield and their Medicare Advantage team. We will be providing a chronic kidney chronic kidney disease nutrition program for about 150 of the members that Jeff mentioned earlier that are in this value-based care program that's been in existence but going much deeper with Anthem and Optum. We have the ability to bring together several key stakeholders involved in the care of these members, whether it's Hartford HealthCare nephrologists, Anthem Blue Cross Blue Shield care managers, local Hartford food vendors, and then NourishedRX in conjunction with Connecticut Innovations, providing these members and these individuals with the food for about 6 months. And we're really excited about the opportunity to dive in. So again, as I close, I want to again say thank you for the opportunity to present to my fellow startups. You guys are crushing it, and I can't wait to see how successful y'all are in the future. Thank you very much.
Awesome. Thank you so much, Jeff. And up next, we have Sonavi Labs. So Sonavi Labs, they create medical devices and software rooted in AI, and it's all applied to auscultation, the act of listening to body sounds. So their aim is to transform the way respiratory diseases and infections are detected and managed across all socioeconomic communities. And with that, I'd love to introduce Chief Business Development Officer, Brandon Haley. Thank you.
Good evening, everyone. Hope you're doing well. I'm Brandon Haley, the Chief Business Development Officer at Sonavi Labs. We're a medical device and software company that's using the power of acoustics and auscultation to really transform the way that respiratory diseases, as we started, but all diseases really are not only diagnosed but monitored and managed from a chronic perspective. This project actually started out in response to a Gates Foundation challenge. Dr. James West is a world-renowned inventor and acoustician based out of Johns Hopkins University. He actually invented the electret microphone, which is right here on my chest, and is a real genius when it comes to sound. He brought in some of the world's leading signal processing and data experts, and what they've been able to do is something really transformative and revolutionary. The Felix technology is designed to address pediatric mortality as a result of pneumonia, but as the technology was developed, the team realized that it had far more reaching applications, specifically supporting chronic disease management. Some of you may be familiar with young Kyriel, who recently passed away at the age of 13 years old from an asthma exacerbation. And when we're thinking about diseases like asthma, they are much more pervasive and really detrimental and burdensome in Black and brown communities. And the reason why is there's a multitude of reasons for that. But what we're trying to do is understand that why, understand how these patients are doing and trending, and really giving them a better way to engage with their providers to reduce those barriers of access. Here in Connecticut specifically, there are Black children who are more than five times more likely to end up in the ER because of an asthma exacerbation. And these kinds of disparities don't need to exist. We can find better ways to engage with these patients outside of a clinical setting and really support them in the home. And what we understand at Sonavi Labs is that across all respiratory diseases, there's a huge gap. We understand that patients with diabetes can use a glucose monitor and know exactly where they stand to their disease on any given day. And the same thing with a blood pressure monitor for hypertension patients. Unfortunately, your respiratory disease patients are using subjective monitors and surveys to understand and track how they're doing. They're answering questions like, how did you sleep last night? And hoping that that's going to be enough for their doctor to understand and implement an effective treatment plan. So we decided we were going to do something a little bit better, and that's where the Felix device comes into play. The Felix device is a small, handheld tool that is a part of a comprehensive platform that can be used by both providers and patients to understand how disease is showing up and how the patient is progressing and how any treatment or medication that's been prescribed is actually working. When we're thinking about sending a device like Felix into the home of a patient, we're thinking about all of the different possibilities that could be present in the home, whether that's a baby crying, whether that's a TV in the background making lots of noise. And what we wanted to do was give providers a really high fidelity experience so that they could be confident in the decision that they're making. We don't want providers to just kind of rely on their own memory, so we've got onboard storage as well as Bluetooth and wireless connectivity, because we believe that this solution could be really transformative and essentially work just like a telephone for your lungs, giving your providers the ability to hear your body sounds not only in a real-time telehealth visit, but also asynchronously as a part of your treatment plan. So if they've just recently introduced a new treatment for you, we can monitor how you're doing and how that treatment is, if that treatment is actually working. And we're using our diagnostic algorithms, which have over a 95% accuracy in understanding and identifying abnormalities. What was really great is that we took that original proof point of just identifying things like wheezes and crackles and stridors, differentiating those from abnormal sounds and normal sounds, or differentiating those abnormal sounds from normal body sounds. But we've gone even further and can actually diagnose pneumonia with a 95% accuracy in pediatric patients. And for that, we will be submitting a breakthrough designation to the FDA, because this is something that has never been seen before. And if you think about supporting clinical decisions and helping keep patients out of the ER, or keeping them from undergoing unnecessary treatments or unnecessary x-rays, specifically for our pediatric patients, we see a huge opportunity here to not only save costs, save time, but also reduce the burden of health care. And what's really great about this solution is that we're trying to make it as affordable and easily implemented as possible. So we've created a solution that providers can use to quickly identify patients that would be great for using the Felix at home. The physician can then distribute the device to their patient and use existing CMS codes to be reimbursed for providing therapeutic monitoring, as well as understanding how that patient is doing from a physiological perspective. Our platform is completely comprehensive because we're trying to understand not only how that patient is doing from a physiological standpoint, right? Are their lung sounds getting better or are they getting worse? But we're also providing a survey that helps you understand the way that the patient is responding to specific social determinants of health, whether or not they are having to forego medication in order to actually take their in order to actually take their recordings or anything like that. So what we're trying to do is really get a full picture of what's causing this patient to have an exacerbation, and giving their care team the ability to understand how they could best provide an intervention. And this is just a quick demonstration of the Felix device.
Hi, my name is Brandon Haley, and I'm the Chief Business Development Officer for Sonavi Labs. Today I'm going to show you how to take a recording using the Felix device and supported app. First, you just simply go to your app and then press take a recording. It will prompt you to connect your device via Bluetooth. And once the device is connected, you'll see the Bluetooth symbol on the screen of the device. And then you can begin taking your recording. It will tell you exactly where to place your device on your chest. And once the recording is complete, it will then prompt you to move to the next location. You'll see it show a green light on the device as soon as you've completed the recording, letting you know that you can then move to the next location. And again, you simply press the record button on the device and it will start to take a recording. And there you have it. And once you have completed all of the recordings, it will then prompt you to complete the questionnaire, and then you're all done, just like that.
All right. So what's really great about Sonavi Labs is that we have been embarking on this mission with partnership and collaboration in mind. And we've partnered with several world-renowned institutions to deploy our technology and to further validate. We've also got thousands of patients that have been screened with the Felix device, and several patents, publications, all of which I'd be happy to talk to you about a little bit later on. Our team is exceptional when it comes to innovation and industry. We've got lots of research experience under our belt. And what we're really looking for is a collaboration with the Hartford community. We're currently reviewing a protocol for a study where we'll be sending devices home with patients to understand how they are progressing. We've just recently completed a study with the University of Antwerp where we were able to show better than spirometry and pulse oximetry changes in a patient's symptoms after receiving a novel treatment. So our goal is to, again, provide objective data to help improve patient outcomes, give providers the ability to understand how their patients are doing, and provide those appropriate interventions at the right time to keep those patients from being hospitalized unnecessarily. I'm Brandon Haley, and let's transform healthcare together.
Awesome. Thank you so much, Brandon. And last but not least, we have Bloomlife. So Bloomlife is a maternal health company improving the health and well-being of women and their babies through personalized prenatal care. And with that, I'd love to introduce CEO Eric D. Eric?
All right, it's fantastic to be with you all tonight. So my name is Eric D. I'm co-founder and CEO of Bloomlife. Bloomlife is a women's health company redefining prenatal care. Our mission is to improve the health of women and babies by eliminating preventable adverse birth events. Now, the demographic trends driving America's birth outcomes are impossible to ignore. Over the past several decades, there's been a significant increase in the rates of high-risk pregnancies. Decades-long shortages of maternal health care providers are creating significant barriers to care, affecting urban and rural communities alike. These factors starkly reveal the limitations of existing models of care, as evidenced by the high rates of maternal mortality and morbidity, which disproportionately affect communities of color. Simply put, there's more high-risk moms that need a lot more clinical care and not enough healthcare providers to support them. We believe women deserve better. At Bloomlife, we're designing the future of prenatal care with technology to improve the health of moms and babies. We combine connected devices with data analytics to improve access to care, empower moms, and increase the capacity of healthcare providers. Our approach to delivering prenatal care allows doctors to more effectively screen maternal and fetal risk, educate the patient, and quickly access specialists regardless of a patient's geography. At the center of our solution is a prenatal wearable that allows us to remotely assess fetal health in the form of what's called a fetal non-stress test. Over 10 million fetal NSTs are performed every year to earlier identify signs of fetal distress that may lead to long-term neurological impairment or potentially fetal death. Current technology limits this test to a clinical setting, and we are developing the ability to move that to the home. For providers, the idea is we want to improve quality of care and increase capacity by enabling remote screening and management of risk. The three most important risks that we're focusing on right now are hypertension, diabetes, and maternal mental health. The use of digital health has many benefits for providers, including increased visibility on patient adherence, helping to early identify moms and babies that aren't doing well, and improving digital and strengthening patient and provider communication, which is really at the heart of quality prenatal care. For patients, the idea is that we want to reduce the burden of navigating a high-risk pregnancy and empower confident self-management. Through the use of connected devices and digital health, we're able to reduce the number of visits, saving patients time and money, able to provide real-time feedback and clinical oversight in between appointments, providing peace of mind to the patient, and also deliver personalized education to help normalize a mom's experience, help her better understand her condition, how to manage that as well. Our business model is simple. We contract with provider organizations to provide remote prenatal screening services. Doctor order our services for the patients and bill insurance companies using existing reimbursement codes. Bloomlife is paid a portion of that reimbursement. In this way, our success is directly linked to our partner's success. The team behind Bloomlife has the necessary technical, commercial, and medical expertise to transform maternal health. Our team is led by world-leading experts in remote patient monitoring solutions that have developed and commercialized industry-leading products in cardiac monitoring, brain monitoring, and general health and wellness. Our clinical program is overseen by a triple board-certified maternal and fetal medicine specialist with a background in clinical research. And beyond our professional experience, many of us have personally experienced the challenges of navigating a high-risk pregnancy. The inspiration for Bloomlife came from my partners and I's own challenge in starting a family that included several years of failed fertility treatments, miscarriages, and then a high-risk pregnancy that included a preterm birth and several months in the NICU. So it's been a really great honor and an amazing opportunity to work in this program, in support of the Hartford HealthCare community and some of our medical advisors, one of which at least you can see here is today. We identified that there's an opportunity here for continue our collaboration beyond this program to look at deploying a remote hypertension management program, which could help pilot what could be ultimately a more comprehensive remote maternal health care program. This program for us has been an incredible opportunity. The Hartford HealthCare clinicians have welcomed us in with open arms. Innovating healthcare is really hard, and you really need to have this open communication with healthcare providers to make sure the problems that we see as entrepreneurs are really the ones that we should be focusing on. And so I really just want to commend the entire Hartford HealthCare community for really creating this open innovation system. Moreover, we had a ton of success working with a specific Trinity College student who's here. Eve, I'm going to call you out because you're awesome. He really, as a sophomore going in to these hospitals with absolutely no experience in maternal health, no experience in ethnographic research, really produced some amazing insights for us on clinical workflows, which we're currently using now. And I also just want to thank our advisors, Dr. Brigida, Dr. Deckers, and Dr. Lindsay. And one more thing about Eve, actually, we were so successful in working with him that even though this program's over, we decided to actually contract with him for another project that we have coming up that's a little bit more in his core, which is computer science. So we're looking forward to working with him. So that's it. I just want to, again, thank everyone, Plug and Play, Hartford HealthCare, Launch Hartford, for the opportunity to join this program. It's been incredibly beneficial to us, and we look forward to continuing to collaborate. Thank you.
Before I go further, wow, wow, wow. All those startups were fantastic, great presentations. Love for you all to join me in just another round of applause for each of the startups. Thank you for each of them coming out here today. So later this evening, just so you all know, each of the startups will have a table upstairs. We encourage you to go up, meet with them, ask questions, and engage with them, and we hope that you can speak with each of the startups that are here today. From here, I'd like to transition to our other program partner, Trinity College. And I am pleased to introduce Joe Catrino, Executive Director of Career and Life Design at Trinity College. Joe leads a team of highly dedicated professionals within the Career and Life Design Center who represent the offices of Career and Life Design, international students and scholars, and retention strategy and transition programs. Joe's expertise includes a focus on life design and design thinking work, in which he encourages individuals to be innovative in their ability to problem solve. And since 2015, when Joe joined Trinity College, he has strategically collaborated with colleagues across campus to identify and implement creative and forward-thinking programs and initiatives that address evolving employment and education trends. He serves as an agent of change and continues to represent Trinity in a progressive way by sharing his passion for design thinking, personal branding, and preparing students for the future of work. So please join me in welcoming Joe to the stage.
All right. Good evening, everyone. So at Trinity College, we are so proud to be a part of this collaboration. As some of you may know, Trinity College has a rich history of teaching students skills in design thinking, critical thinking, creative problem solving, and all-around innovative and entrepreneurial mindsets. In the Career and Life Design Center, we empower students and graduates to be active agents in designing their careers and to use their liberal arts education to adapt to and transform the future of work. We strive to ensure student satisfaction and student wellness. We thrive in the chaos of student decision-making. And there's a great illustration. I don't know if anybody's ever seen it, but we show this to first-year students all the time. There's a box. And the box says, what I planned for in college, and it's a straight line arrow. Then there's a box next to it that said, what actually happened? And it's a bunch of loops and turns and twists and all those good things. But we thrive right in those twists and turns with the students. That's what our office does. That's how we operate. We work with students as they transition in, through, and out of Trinity and beyond. We help students connect with opportunities across the globe, but especially here in in Hartford. Through this partnership this summer, we were able to connect 5 Trinity students, as you can see from the slide, Oh, I do? There we go. Thank you. We were able to connect 5 Trinity students with a startup partner, and you can see them here on the slide. This was a unique experience for each of the students, and a worthwhile investment of their time and major component of their career design. Recently, we announced the Entrepreneurial Center initiative on campus that will complement and enable Trinity to hone its focus on how the college supports our students, faculty, staff, alumni, and partners on their journeys, hopefully making a transformative impact to make the world a better place. That's what we aspire to invest in our students, a propensity and purpose towards positive change in the world. This is a major initiative for Trinity with the highest levels of commitment and visibility. Building partnerships and connections are critical and crucial to the work we do. So I'm sincerely grateful for this partnership and really, truly look forward to future collaborations. Thank you. Have a good night.
All right, guys, I'm bringing it home now. We have one more speaker, very special speaker, who we're going to beam in on Zoom, and that's Dr. Barry Stein. Barry Stein is the Chief Clinical Innovation Officer and Chief Medical Informatics Officer at Hartford HealthCare, where he also practices as a vascular and interventional radiologist and is an assistant clinical professor at the University of Connecticut School of Medicine. He has held numerous leadership positions, including Chief Imaging Informatics Officer at Hartford HealthCare, Vice Chair of Radiology, Chief of Cardiovascular MRI and CT, Director of the Advanced Imaging and Quantitative Analysis Core Laboratory at Hartford Hospital. That's a mouthful. Doing a lot, Barry. Okay, so he's recognized as an expert in cardiovascular MRI and CT and was one of the pioneers in magnetic resonance angiography. Barry continues to remain engaged at MIT, serving on the Sloan Alumni Board, participating as an invited lecturer on courses on innovation. He's also a mentor for MIT Link Accelerator programs in the MIT Institute for Medical Engineering and Science, a host to students from the MIT Initiative for Health Systems Innovation, as well as co-principal investigator conducting clinical and operational health systems analytics in collaboration with Sloan faculty at Hartford HealthCare. So Barry is currently focused on building a differentiated healthcare innovation ecosystem here in Hartford at Hartford HealthCare, and to leverage current and future technologies to accelerate digital health and clinical transformation. Now, sadly, Barry could not be here today because he has COVID. Such bad timing. We were so sad to learn it. But I have to tell you, I have known Barry since before the pandemic. We started working on this very thing that long ago, and his indefatigable sort of energy and drive to get this done really paid off. And so we can't thank him enough. What I would love to do, if I could, is take a picture for him, if that's going to work, or maybe have the photographer come and take a picture so Barry could see what it would look like if he were standing here. But maybe could everyone wave? Go for it. That'd be awesome.
Hi, everybody. Hopefully you can all hear me. That was an incredible show of pictures. Congratulations, and I would love to hear a round of applause for world-class pictures, for sure. So congratulations, Deb and Chris and Jeff and Brandon and Eric, for incredible work and incredible pictures. And most importantly, your commitment to focusing on closing the health equity gap, which is our call for action today. I've personally had the privilege of getting to know each and every one of you. And I'm just so impressed with your social conscience, your fierce focus to solve some of the biggest problems in healthcare today, your creative spirit, your relentless curiosity, a passion to make a difference, and above all, each one of you being such magnificent human beings. So thank you so much for choosing Hartford and Hartford HealthCare to accelerate your solutions to impact. Thank you for choosing our Health Equity Accelerator, a world-class accelerator in a world-class innovation ecosystem. We know you have choices and are very grateful that you chose us to do your most important work. Innovation, as you have gotten to learn at Hartford HealthCare, is a team sport, and we're proud of that. Hartford HealthCare is a magical environment where the impossible is always possible, where the status quo is never okay. Every day, Jeff challenges us to make sure that we're challenging the status quo. Innovation is part of our DNA, and I'm sure each and every one of you have gotten to experience that. Innovation at Hartford HealthCare is about distributed leadership. It's a team sport, and each and every one of you got a taste of the incredible clinical mentorship in our organization, as well as other functional mentorship in the organization. At Hartford HealthCare, we are also fiercely focused on solving many different problems, but we particularly focused on making sure that every single one of our patients has access, the care is affordable, that there is health equity, and there's excellence in quality and safety. And we are particularly proud that each and every one of you as startups is solving and helping to solve each and every one of those 4 pillars. We're also incredibly fortunate at Hartford HealthCare that we have leadership buy-in to support innovation from the top. It was incredible to listen to Jeff today. And for those who listen to him for the first time, it's always inspiring and always unforgettable. But each and every day, that's how Jeff shows up for all of us at work, inspiring us to do better. And I know that he is fully committed to supporting the work that you've just begun at Hartford HealthCare. But it's not just Jeff. It starts at the top at Jeff, but it goes throughout the organization. And we are so grateful to have the partnership and the support and the enthusiasm of our Chief Financial Officer, Oke Agba, our Chief Operating Officer, Mike Daglio, our Chief Clinical Operating Officer, Jeff Cohen, our Chief Clinical Officer, who I report to, Ajay Kumar, our Chief Strategy and Transformation Officer, Karen Goyette, and our Chief Legal Counsel, David Mack, all together finding ways to support all the innovation that's occurring at Hartford HealthCare. There are very few places on the planet where you can have that kind of alignment of leadership, enthusiasm, authentic support, and ambassadorship for the most important work that all of you are doing. But equally importantly, there are folks that are doing all the connections, all the organizing, all the evaluation of startups, and all the activities of the innovation on the ground at Hartford HealthCare. And they include folks like Claire Cryer, Candy Carlson, and our entire innovation and informatics team. Partners like Rocco Orlando and Beth Chatty, all along the way. So thank you all very, very much. And I know how much this evening means to all of them, and to be able to support the startups. We as a family are incredibly excited to continue your journey, each one of your startups, and explore opportunities to partner with you along your journey at Hartford HealthCare. And lastly, but not least, I want to thank Michelle Cote from Launc, Mayor Bronin from Hartford, who always has his door open and always has his phone on. Governor Lamont, who continues to be supportive of innovation within the state of Connecticut. Matt McCooey and Mike Cantor at Connecticut Innovations, who have seeded many of your companies with dollars. And many, many more that have made this evening possible. So I wish I could have been there today, but I watched the entire thing, loved every minute, super excited about what's to come, and thank you so much for this opportunity.
Okay, thank you so much, Barry. All right, thank you so much, Barry. Thanks to all of you. That wraps it up for us. So I hope we can have a great time networking, eating some fantastic food. See you all at the party back there. Thank you.